Welcome back to Allergy Actually, where three allergist moms and best friends break down the science that's shaping the future of airway and immune health. Today we're talking about something that's been everywhere, GLP-1 medications. Ozempic, Wegovy, Mounjaro, you've seen the headlines, but here's the twist. People with asthma and inflammatory conditions are asking, is this actually helping my symptoms, or is it all hype? We're digging into what the early data shows, what's realistic, what's still unknown, and what we're seeing in real patients. This is one of the biggest shifts happening in metabolic and immune medicine, and you deserve clear answers. So guys, is there data? What's the data with GLP-1s and asthma or allergic inflammation? What's out there?
Yeah, so let's do a quick refresher on what GLP-1 actually stands for. It's glucagon-like peptide, and it's an incretin hormone that is secreted from special cells in our intestines called bowel cells after we eat. And really, it has a few major roles. It helps with secretion, it slows gastric emptying, turns down appetite, and it regulates how full we feel. And, there are some variations too. So tirzepatide does a little bit more, which affects insulin and some of the inflammation in our fat tissue too. So I think the question, has been like in some of the things, we're hearing, okay, we're studying it. We've studied it and it's approved for sleep apnea, for weight reduction in certain instances, and for type 2 diabetes. But a lot of these things go together. So, I think that is, by the time this airs, a few months out probably from the most recent American College of Rheumatology meeting and allergy meetings as well, that these were all the talk kind of in amongst patients, amongst docs.
As anti-inflammatory.
Yeah, turning it down. So maybe we can take a step back to think about the role of obesity and how it plays in with asthma.
Yeah, we know obesity drives inflammation and that patients that are obese and have asthma have more difficult to control asthma. Have either of you treated any patients that had either overweight or obesity along with asthma that maybe they were on a GLP-1 for some other reason? How did it affect their asthma or allergies, if at all?
So I have had more recent experience. Honestly, this just came to me as we were saying this. I have had a couple of patients recently who have chronic urticaria, so chronic hives. And they have presented to me a lot of evidence that they get from forums and Facebook groups and things like that, where a lot of people have been talking about being on one of the GLP-1 medications and how that has helped their chronic hives. And I found that fascinating. And so I had a patient who was able to basically stop all of her medicines after starting that. I was very intrigued about that. And so I'm excited to see if in the future, if there's anything that comes of that. But for asthma specifically, I feel like all of my patients improve with weight loss. Mm-hmm. And I personally have asthma, and I used a GLP-1 for 4 years. My insurance covered it at first, and then I ended up having to kind of pay out of pocket and do all of that after my insurance stopped paying it. But I got to my goal weight, and some personal things that I noticed that I found fascinating. So first, I'd been on it for 2 weeks, and I realized that I was having significantly less anxiety than I typically do. So I have pretty severe OCD and generalized anxiety disorder. So this is going to be a sharing episode. I'll just lay it all out there. And so I've had that since I was a teenager. And I was going through a time period where I was deciding whether or not I was leaving my steady, stable, good job in academics and starting my private practice, while at the same time, my husband didn't have a contract that extended his work beyond the following week. And I was remarkably fine with all of these things. And I remember I was driving down the road and I had all 3 kids with me, and my husband, Jay, he is an anesthesiologist, so he was on call. And that's usually kind of a stressful weekend for me. And I was just having the time of my life. And I thought, this is very different. And when I started researching that, it does appear that there can be effects on anxiety and things like that. And so I was pretty happy with that. And so I will say that is something that I have continued and get some benefit from still. Now, with asthma, it was such a gradual thing that I am not really sure how much it helped. And I did have to start a biologic for my asthma in the last year. Now it's, I guess, been about 2 years. So I'm not sure how much being on the GLP-1 had any sort of anything to do with that. I'm just not sure. But in general, I feel much better overall. And I still do a small amount, like microdosing of GLP-1 every now and then. I only do it probably once every 6 weeks or so because I'm pretty sensitive to it. But, with all of the cardiac benefits that we know that it has, depending on your family history, it's can be a good idea even just for that. So I'll say my pulmonologist told me to stay on it.
When we're talking about asthma and overweight, the other thing that comes into the equation is exercise. So there are people who don't exercise on purpose because it flares their asthma. And then you get into this chicken versus egg cycle where, okay, am I not exercising because I can't breathe? Or can I not breathe because I'm not exercising, And so I think that's something to think about in patients with asthma. I tell my patients, your job is to live your life, do the things you want to do, and not let there be anything that you say, I'm not doing this because of my asthma. My job is to help get to know you and to know what you enjoy doing and support treating your asthma so that you can do the things you want to do. And exercise is absolutely one of those. So I guess tying this back to weight loss was my point, was if you have asthma and you're overweight or by the book obese, which many Americans are, and maybe you're not exercising because it's hard to breathe when you do it, losing your weight can help. And that's where the data might not be so much right now on do GLP-1s help asthma, but more GLP-1s will help reduce the weight burden that sometimes contributes to the inflammation of asthma and makes asthma harder to treat.
There was a case series that was published not that long ago, Meagan, in patients with mast cell activation, which I think of in a similar vein as our chronic Hives patients. And it was a retrospective, just kind of a group of physicians' experience in using very low doses of GLP-1s in getting better control of mast cell disorders. So, what the mechanism is and where this will land kind of in our treatment paradigms with other, new meds that are out that are oral, it'll be interesting to see, but that might be, shed some light on where we're headed.
And I guess one final thought is about acquisition of these drugs. And I just wanted to add that while this is an ever-changing landscape right now, with some recent conversations with pharmaceutical representatives, there are some of these brand name products that are approved for weight loss if you have another chronic condition, and asthma counts. So if you are asthmatic and are overweight or obese and are interested in trying one of these medications, look for the ones that are approved for that and work with your doctor to see if it would be covered by your insurance. All right. Thank you for joining us today. GLP-1s are changing conversations about weight, inflammation, and now maybe even asthma. There's a lot of curiosity and almost as much confusion. So if this helped you sort through the noise, hit follow, share this episode with someone who might be wondering the same thing, and drop a quick review. It helps our community grow. If you've had your own experience with GLP-1s and asthma or allergies, hives, mast cell, message us on Instagram or on our YouTube comments. We might feature your story in an upcoming episode. See you next time on Allergy Actually.